We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it. Platform 1 in detail will see being an accountable professional, that is being a responsible nurse. Registered nurses act in the best interest of people, putting them first and providing nursing care that is person centered, safe, and compassionate. So, when you are registered nurse and under this Registered Nurses Act, when you are registered nurse, they act accordingly. They act person centered. In on individual level, they keep on changing their care what the person needs the most. They care accordingly. It is in the best interest of people, means they do the best whatever is necessary. They act professionally at all times and use their knowledge and experience to make evidence based decisions about care. So they are professional, and whatever decisions they take, it is evidence based. They just don't take any decision, they just don't select a particular treatment. It should be all related to evidence. They communicate effectively, are role models for others, and are accountable for their action. The communication is nice, they do clear communication, they are role models. Like looking at them, we know how a nurse should be, their skills, the way they treat, the compassion they show, everything. They be a role model for people around them. And always they take responsibility of their actions, whatever they do. Registered nurses continuously reflect on their practice and keep abreast of new and emerging developments in nursing, health, and care. So, what they do, they keep on doing right things, they keep on practicing, they keep on learning. Ever then and now and then, there are some changes in the setting, there are some changes in the technology, environment, and the external factors. So these nurses, they emerge, they evolve accordingly. Yeah, they are not rigid. So from the platform 1, what are the outcomes? Yeah, in detail they will be showing here what we expect from nurses. The outcomes set out below reflect the proficiencies for accountable professional practice that must be applied across the standards of proficiency for registered nurses as described in platform 2 to 7 in all care settings and areas of practice. At the point of registration, the registered nurse will be able to. So, when you're registering yourself, what proficiency you should be having, what skill you should be having. Number 1, understand and act in accordance with the code. So the code, if you all have not seen the code video, it is in the playlist of CBT material. So there are some standards, values, how the nurse should act when you're working with as a registered nurse with UK, England. So this is given in the code, all the information. So here they are saying that you should be able to understand the code, you should study the code, work accordingly. Professional standards for practice and behavior of nurses, midwives, and fulfill all registration requirements. So whatever are the requirements for registration with NMC, you should fulfill it. Number 2, understand and apply relevant legal, regulatory, and governance requirements, policies, and ethical frameworks, including any mandatory reporting duties to all areas of practice, differentiating where appropriate between the devolved legislatures of United Kingdom. So whatever relevant things are required to register yourself, you should follow all of it. Third, understand and apply the principles of courage, transparency, and the professional duty of candor, recognizing and reporting any situation, behavior, or errors that could result in poor care outcomes. So, this is told in the code that if any mistakes are done by you, or if you come across anyone giving poor services, or there is some poor care outcomes, you should always know whom to report to. You should never hide your mistakes if anything is done, so that it doesn't hamper the public health, the patient's health. Patient health is important, and so you should have that transparency if anything is committed. Number fourth, demonstrate an understanding of and ability to challenge discriminatory behavior. You should understand, like within your view, if you come across any discrimination, you should be able to stand against it. Also, you yourself should not be a part of it. Fifth, understand the demands of professional practice and demonstrate how to recognize signs of vulnerability in themselves or their colleagues and the action required to minimize risk of health. You should be compassionate towards everyone, towards yourself also, towards your team also. If someone has any issue regarding their health, you should be able to help them out with support. Understand the professional responsibility to adopt a healthy lifestyle, to maintain the level of personal fitness and well-being required to meet people's need for mental and physical care. So as a nursing team or working for public in the healthcare, we should make sure that we have a healthy lifestyle, so that our body helps us to give that strength to help someone mentally, and also we can take physical care of them. Next is 1.7, demonstrate an understanding of research methods, ethics, and governance in order to critically analyze, safely use, share, and apply research findings to promote and inform best nursing practice. So, here it tells that if any new methods come up, or any new ethics, or something new in the research comes up, so the nurse should have that knowledge how to use it. He should know when to use it, and properly evidence based, and according to the research you should have all the knowledge to apply it. Next is demonstrate the knowledge, skills, and ability to think critically when applying evidence and drawing on experience to make evidence informed decisions in all situations. If you see in these outcomes, many points are interrelated, or few have been explained in such a manner that sometimes we feel it is repetitive, but the outcome is same because they are explaining a particular platform. So here, whatever decisions we take, we should always make sure that it is evidence based, and critical thinking is very important. Like as I told you, every individual is different, then the conditions are different, every body responds in a different manner. So we should make sure that whatever steps we take for the treatment or care, we should be able to critically analyze it always. Also, through different experiences, what we went through while taking care or through the treatment, we should make sure that it helps us to improve. Yeah. And in everything, we should always take decisions based on the situations and evidence only. Next is understand the need to base all decisions regarding care and interventions on people's needs and preferences. So whatever decisions you make, as we know, public is aware, they have few rights for their own health. So we should take all the decisions taking their consideration and preferences and needs into picture, recognizing and addressing any personal and external factors that may unduly influence their decisions. So whatever decisions patient makes, we should be able to understand it. It can be the decision, or whatever they are saying, it can be related through their personal experience, through the personal factors, or some external things, but we should be able to understand it and accordingly work with them hand in hand. Next is 10th point, demonstrate resilience and emotional intelligence. Demonstrate resilience and emotional intelligence and be capable of explaining the rationale that influences their judgment and decisions in routine, complex, and challenging situations. So they say that we should always show up that we are trying to find out the way to cope up, and we should have that emotional intelligence. So your resilience is nothing but that we should be able to fight, not in the argumentative way, I am saying, means we should be able to understand the situation and accordingly work towards it. That is what resilience means here. So we need that outcome, whatever outcome we need, we should be able to get it, and in a proper way, while explaining the patient. If they are saying that a particular treatment they don't want it, or any particular medication, so make sure that you listen to them first. What if they have any allergy towards it, or is it just a fear? Accordingly, we should be able to explain them properly, so that the decisions are influenced in that manner. Yeah, whatever the challenging situations are coming forth, we should be able to work accordingly with an emotional intelligence by connecting with them. Next is 11th point, communicate effectively using a range of skills and strategies with colleagues and people at all stages of life, and with a range of mental, physical, cognitive, and behavioral health challenges. So, whichever department we are working in, whichever persons or patients' care we are taking, whatever are their needs, accordingly, we should be able to communicate effectively. We need to use different skills and strategies according to person, according to their disorders, or according to whatever they are in need of. Some are vulnerable regarding a few part. So accordingly, according to their age, everything we should take in consideration and work. Also with colleagues, also with people around us, we should be able to work in a proper manner, coordinate properly. Next is 12th, demonstrate the skills and abilities required to support people at all stages of life who are emotionally or physically vulnerable. So those who are weak in this emotional or physical way, we should have that ability as a nurse or a nursing team to help and support them. 13th, demonstrate the skills and abilities required to develop, manage, and maintain appropriate relationships with people, their families, carers, and colleagues. So the colleagues with whom we are working, or the family, the patient's family whom we are taking care of, the patient, their family, then their carers, the people around, we should have a proper relationship with them, a professional relationship. And emotional touch and emotional intelligence should be used while communicating and having this relationship. Though it should be professional, but humanity should be there. 14th, provide and promote non-discriminatory, person-centered and sensitive care at all times, reflecting on people's value and beliefs, diverse background, cultural characteristics, language requirements, need and preferences, taking account of any need for adjustment. So while providing, we should care, we should not discriminate. We should make sure that people are from different race, country, background, language, culture. All these characteristics we have to keep in mind and accordingly communicate effectively. And accordingly, we have to make sure that we adjust according to their needs. 15th, demonstrate the numeracy, literacy, digital and technological skills required to meet the needs of people in their care to ensure safe and effective nursing practice. We should be able to calculate, because few drugs are supposed to be calculated and given. We should be digital and technologically sound. We should be able to use it properly. Yeah, some new instruments which we use while checking, while giving treatment. So we should be aware of all those things so that we give a proper care, a safe care. Effective nursing practices involved. 16th, demonstrate the ability to keep complete, clear, accurate and timely records. Whatever we do, we are supposed to maintain the record then and now and then and there at that right time only. We should not keep it pending. So make sure that it is timely recorded. 17th, take responsibility for continuous self-reflection, seeking and responding to support and feedback to develop their professional knowledge and skills. Always make sure that you should continuously self-reflect is you should keep on checking that whether you are doing a particular task properly. You should keep on learning, advance your skills, make sure you update yourself, and whatever feedback you receive, you should ask for feedback. If you support and feedback whenever you need it, and take it in a positive manner, try to develop. 18th, demonstrate the knowledge and confidence to contribute effectively and proactively in an interdisciplinary team. Always be confident enough of whatever things you know. Go and learn it if you don't know. Tell them there at the very first moment, whichever you receive, that if any particular thing you're not able to do, tell them. After telling them, you need to learn it and exercise it and be confident while doing so. No patient should be in any harmful situation due to you. 19th, act as an ambassador, upholding the reputation of their profession and promoting public confidence in nursing, health and care services. As a nursing team working with them, or as in this profession, you should make sure that when people look at you, they think of you as a nurse or a midwife or any nursing associate. And so we have to behave, we have to even demonstrate through our actions, whatever we do, that we are upholding the reputation of this profession. We should not do anything which harms the reputation or the confidence in us of this public. So make sure that you practice it accordingly. 20th, safely demonstrate evidence-based practice in all skills and procedures. Properly you do all your process stated in Annex A and B. Remaining content is in the next video. You all can look in the description box for the links.